I'm your host, Dr. Risa Ravitz, and I'm not your average neurologist. My interests and passions run deep, and I'm constantly pushing myself to find truths. I'm a medical doctor, a woman, a surfer, a runner, and an exerciser, and an avid reader of all topics. It's not easy to sift through all this information, and there's many podcasts out there. So let's try to get through this together. So excited to be here tonight with my friend and a patient, unfortunately, Hoovie. I'm not going to say your last name. We'll just say Hoovie.
Yeah. Thank you for having me. Happy to be here.
Great. So, all right. So why don't you tell the audience a little bit about what happened?
Yeah. So I was in a pretty bad car accident in February of this year. I had a head-on collision with a car. My airbags didn't deploy, so I hit the steering wheel pretty hard.
Your head?
With my
your
head.
face?
Yeah, with my face, yeah. I broke my nose, and got lots of bruising around my face. I tore some shoulder blades. So there was a lot of physical pain at first. And then once kind of
So I'm going to keep interrupting so we get some more details. And I'm sorry this happened to you. This is awful. So did you lose consciousness? Do you remember? You did.
Yeah.
So you saw the car coming, and then there was an impact, and then what's the next thing you remember?
The next thing I remember is a woman banging on the window, kind of yelling, get out of the car. And then the emergency system in my car was like, "You've been in an accident. Help is on the way." It was so
Seriously, your car was telling you?
Yes.
Oh, man.
Which is great. They called the cops, but they still took forever to get there.
Did the car call the cops and the ambulance? Oh, that's actually kind of cool.
It is cool.
Okay. All right.
Yeah. And then I kind of looked down and I was covered in blood from my nose. And then she pulled me out onto the grass and I kind of passed out there. She took my phone and called my emergency contact, which is my sister.
Huh.
And then I went in an ambulance to the hospital, and the entire ambulance ride I kept saying, do I have teeth? My whole face was so numb from the impact. And then I spent about 2-3 weeks in bed. I couldn't get up.
So there they checked you. I remember, right? They basically did, I think, a facial CT and a head CT, or just a
full body CT.
Oh, they did. So they did probably the trauma protocol, which is to look for any kind of bleeds in the brain, God forbid, and also
spine.
They usually do your neck. Yep, the C-spine, and then did they do at your chest? They might have.
I was honestly in and out.
In and out. Yeah. Okay.
Yeah.
And then they didn't need to do any surgery or anything that night for your nose, correct?
Right. They sutured it up. And then they kind of just sent me home with referrals to trauma doctors.
Okay.
Yeah.
Okay. So then what happened? So I interrupted you. So basically you were in bed for a couple weeks.
Yeah, I was in bed for a couple weeks. Just so dizzy. I was physically crawling to the bathroom.
Room spinning or
room
really
spinning, intense nausea. And then my whole face was so swollen. I was literally an eggplant. I was just purple. And I got these cold eye mask things, and I just looked like this zombie. I don't know, concussion Spider-Man or something.
Yeah. Did you have headaches right away or no?
So
I was more face.
Yeah, it was just the whole head. So I didn't realize it was a headache. I was just my head hurts,
I got it. But your body hurt too.
Right, just everything hurt. And I was also just so dizzy that that just took over every other sensation. Yeah. I felt wildly hungover. But more.
Did you have visual changes or no?
Yeah, I couldn't I couldn't work. I had to take off work for a few weeks because I couldn't see.
You couldn't see, or it was too hard to or you just feel like it was too blurry to actually
I would start throwing up. And then it also just was you ever had those eye doctor tests where they put the drops in to dilate your pupils, and you're trying so hard to look, and the harder you look, the more blurry it is?
Yeah, so it's like that.
Yeah.
Oh, wow. Okay. And then tell me a little bit about the healing part. So slowly some of those things got better, and what kind of remained?
So what remained was the dizziness, the headaches, and the shoulder pain, which moved into the neck. So I started doing physical therapy. I did physical therapy for 3 months. It definitely helped a bit. They did some microneedling. We did like visual testing and like balance. So I would like stand on one leg and they'd put an object over here and an object over here, and I'd kind of look back and forth, kind of trying to get my brain to do whatever it's supposed to do. We did exercises to strengthen my shoulders and my neck. And it did get better. Like I was able to drive longer than 5 minutes without like needing to pull over from dizziness, but it still wasn't great. Like if I would go like to the supermarket, like I fainted a few times. Like
Really? Like lost consciousness?
yeah,
Like, kinda...
like I like was at the checkout counter and like they like sat me down and like gave me water. They're like, should we call 911? I think that's the day I actually reached out to you, because I called Leia, a friend of ours, and I was like I think I'm dying, and she was like, let me call Risa.
So how long was that? Do you remember? Like about...
So that was in May.
So the accident was in May?
No, the accident was in February.
Oh, wow. So, okay.
Yeah.
So
and so that in May
later.
and June, I was still
March,
like
April.
so dizzy.
May.
Yeah.
So three months later. So, you know, for the listeners, like I get so many concussion patients and questions, and this was obviously a more severe one.
Yeah.
You know, you lost consciousness more than once. It was higher impact, like the car that you were at a stop, correct?
No, I was on a main road. I didn't have a stop or a light or anything. I was just...
You were going along.
I was just going along, and
okay.
a truck didn't stop at a stop sign and just barreled into me.
Okay, so that's a higher velocity type concussion.
Yeah.
So, and you definitely hit your head right on the dashboard, on the steering wheel, and the airbags didn't deploy. So this is, you know, a more, not super severe, thank God. There was no bleeding, but it was, you know, pretty moderate to severe, like, concussion. And a lot of times, and I think this happened a little bit with you, is that there's so many other injuries and pain initially that you basically like don't end up like feeling those symptoms, you know, until a little after, or they show up a little later, and they last a long time. So that's like months of that, right? Like months of not being able to really function properly.
And I think that was super shocking for me, because I feel like we read about concussions all the time. Or I mean, like, I feel like I do. You watch movies and people are like, I was in a car accident, I have a concussion. And then they just kind of go about life as normal, and you're expected to.
Yeah.
And I did not realize the severity of like, I was like, oh, it's a cold. Like, it's not a big deal.
No.
And I was like, I was not functional.
Yeah.
Especially like I drive into the city all the time. Like that's like for me, like I just drove in here. It's not a big deal for me at all. But like during the 6 months, like driving that hour was so hard. Like, oh my God.
Yeah, so I mean the brain does everything, right? So it functions, it sends out signals to do everything, and sort of any task that it has to do, it requires some energy. So what ends up happening with concussion is people try to do more things like their usual, which is like maybe their usual is not seemingly so much. Like, oh, I want to drive to the city a couple days a week, or I want to be able to sit at home on my computer and do my job, or do a light exercise, or make dinner, or send some emails, or whatever it is. Typically with concussion, those are really, really hard tasks. And it's and the more you do, the more you layer on those things, the harder it is, and your brain does not like it. It really doesn't function well. Right. So, so tell me again, do you have a history of migraine?
So I do get migraines occasionally, but like nothing like that. Like maybe once a month, and usually like brought on by like working 10 hours a day, not drinking enough water, then driving 3 hours or something. Like something like within a realm that makes sense. Definitely genetically predisposition to have migraines. Like everyone in my family has them. Okay. But like definitely like I know when I would get them, like things that to me would make sense. Yeah. You know?
Yeah. So I think that you know, that gives you a little bit more of a predisposition to have a worse concussion as well.
Okay.
So we talked about that a little bit, but
Right.
it's basically your brain already has this propensity to do this thing that it shouldn't do,
Right.
which is the migraine, and then you get damage to something that's already, I don't want to use the word damage, but it's kind of like damage. It's
Right.
it's
Vulnerable.
like vulnerable.
Right.
That's a
I was
much
actually
better
just
word.
watching that episode where you talked about that yesterday.
Yeah?
Yeah.
About the vulnerable brain?
Yeah,
Or
where
about-
you were saying like if you have migraines and you don't like take Advil or whatever, the worse it gets, the more you have them.
Yeah.
Yeah.
Yeah. So like a pattern behavior. So you already have this vulnerable brain. That's a great way to put it. I love that. And you know, then you get this hit that's really severe, and for those people the recovery is longer. Like I think your recovery actually, it was long. It was longer than I would like.
Yeah.
But you know, it was a severe concussion, and you have this history of migraine. Did you have other hits to your head, like growing
In my
up?
life? No.
Nothing major.
Yeah, I didn't play sports or anything.
Okay. No falls or anything.
Well, I played soccer once when I was 11 and I broke my arm, so then I kind of just stayed away from all sports.
Okay. Yeah, we have a soccer player here, so then you know how it is. Yeah. Yeah. So, all right. So you were taking, and remind me, when you came to see me, you were taking just some like over the counters and
Yeah, I
some
was
muscle,
taking Excedrin almost daily with Advil.
and it wasn't.
And it wasn't, and I was doing like the physical exercises, you know, like the chin tucks, they tell you are supposed to help, the eye movement things. I'd gone and taken like, it's called a PNG test, where they test like the brain functionality, and they were basically like, oh yeah, you have a bunch of issues. And I was like, great, what do I do with
Like
that now?
deficits, right?
Yeah.
Like in places that you couldn't like complete the task. So
Yeah, like processing
yes,
things. Yeah.
yes. So they do that now. I think they developed a lot of that, like with the like after the NFL problems with concussion, and they're sort of just trying to see where you're. The problem is like you didn't have a baseline because you didn't do that test before, correct?
Right.
So, but there's still definitely processing issues for someone that's sophisticated and can handle multitasking and sort of doing everything. So, and also you're a good game player, right? If I remember.
Yeah. Not like gaming, like
No,
games.
like board games. How is your board game playing
My
during all
board game
this?
skills. Well, now it's gotten better, like
Yeah.
since I was treated by yours truly.
I have to say, like, I hate board games, and I was like destroyed by this one over here.
What did
during
we
board
play?
games. I don't remember, but everyone was so much faster than I was, and I was like so sad. It was. You don't think?
I do remember you just
I
being
think
like,
it's like age, maybe. I don't know. No, it's like really
I think
bad.
I've definitely played that game before, so I did have an advantage.
I don't know.
Like
You're
I did
giving me
already
credit.
remember the answers.
Yeah. So why don't you tell everyone what we finally did?
Yeah. So, well, first off, I feel like I wish I had come to see you sooner. I feel like that would have changed the trajectory of my life a little bit more.
Hopefully, but it
Yeah.
does take time. Like there's one of the big things about concussion is time is really big. It just like there's nothing we can do about it. Like hurry up and wait. Like that's literally what
Right.
it's like. So
How do NFL players get back so quickly?
want the real answer?
Yeah.
I mean, they're basically like,
Just ignoring it.
yeah, I don't know if they're all ignoring it. Like I don't want to say that, but I can tell you like, you know, they're getting paid very big salaries to get back on the field and play, and you know, that's been a big point of contention, like about how soon they go back and how quick they go back and whether that's okay. And then, you know, one of the things that's actually really dangerous about concussion is something called second impact syndrome. So there's two things. There's second impact syndrome, which is basically this horrible thing that happens where someone gets a hit to their head,
Yeah.
not like you, like yours was significant enough to do that, and then you get a second hit that's not as bad,
Yeah.
and the brain swells, it reacts and swells, and people die. It's actually really scary.
Yeah.
Like it's really scary. So like you hear
When
that
I was
about
Googling my symptoms, I kept getting that, and I
yeah,
was like, oh my god,
yeah,
I'm dying.
no. But it's like so with football players, that's one of the reasons we don't want to have them because they get a lot of hits, like even when they don't even notice.
Right, just like collisions.
Yeah, collisions, and then they basically
No, tackles. That's what it's called.
tackles,
Sorry, not
collisions.
sporty.
Yeah, you're pretty good. You're better than I am. You collisions, tackles.
Yeah.
It's collisions too because they collide,
Right.
right?
Right. That's true.
But they get tackled. They get, a lot of stuff.
Slammed.
Body slammed. I think it's wrestling, right? Is that wrestling? Yeah. So it's rough, right? So people, it's a very dangerous thing that happens. Like I worry about that thing with like skiing. Someone like hits their head badly, and then they want to ski the rest of the week because they took the vacation and they paid all this money, and I'm not happy about that. That's higher velocity. So that's one thing that happens. And then just in general, it's not great to hit your head. And it's definitely not great to hit your head over and over and over again. So one of the things we're worried about, and thank God this isn't relevant for you, but in football or soccer, not as much, but a little bit, we think that actually a lot of the problem is the number of hits, like the actual number of hits that somebody gets in a season, that causes the longer term like brain damage and issues. So in general, I want people not doing those things. Like if you're not getting paid millions and millions of dollars to like, that's your livelihood, and you made a choice to like do this thing.
Right. Don't play sports.
Don't play the sports.
I know a lot
until you're
of moms
better.
are very worried about like their kids playing like in like the real like leagues where kids get like like football or whatever.
Football, and also like I'm gonna say soccer, like head balls. Like when they start to go to heading, it starts to get a lot rougher.
So basically, only play baseball and basketball.
Basketball is like a little better for some reason.
Well, because there's also like head things.
Yeah, it's also like I think it's like lower. It's
like
kind of
on
contained.
The ground. Yeah.
I don't know. I guess so. But
and also there's much more fouls. I know, like if you like block people too hard.
Oh. A lot of. This is not a sports podcast, but it could be. It could be.
Like if that's like a huge clientele for you, right? Like,
it's like the population that doesn't like know about sports, right? It's like that clientele is the one who gets migraines and concussions. No, but this is but the thing is like this I liken to this to something like that, and also people do get into accidents. So I see your case many, many times a year, unfortunately.
Yeah.
Yours was more severe than I like to see, and I'm glad you're okay, but it's like.
Well, thank you for validating that. Actually.
Yeah.
I appreciate that.
No,
because I feel like it's very gaslighty. People are like, "Oh, you're concussion, you're fine."
Yeah. So what happens is like with something like you get a scan and it's normal, right? So that you didn't bleed, thank God. You didn't bruise your brain, and there's nothing to see in the MRI that's like proof of injury, right? So like your shoulders, we could see that there were tears in the ligaments. Your nose was obviously broken and bleeding and all that stuff. But like with a head injury, we can't, unless it's like super severe, and I'm so glad that didn't happen to you, we don't, 80% of them, we don't see anything. So like people ask for like, like the insurance companies and your employer, they ask for like objective tests, right? So they're asking for things like MRIs, and thankfully that some of the PNG testing that you did is like a little more validating now and people understand it, but it's still like a sort of this topic that like I think people don't get. And then when you add in some of these other symptoms, let's get into some of these other things. So very dizzy, very nauseous. Light bothered you?
So much.
Yeah. So these are sound. So these are very much like post-concussive type things, motion, that the brain cannot, like normal things, it could not like feel, tolerate, process like normally at all. And those things.
Why is that?
So the brain really does everything. So it's doing these things that we just take for granted, which is like noticing where your head is in space. You turn your head and it's got to like calibrate your eyes again and say, oh, I looked up. Actually, I'm not upside down. Okay. So it's doing these things like that. The meninges is the lining around the brain. And when there's some damage there and pain signaling, you can get light sensitivity and sound sensitivity. So it's constantly like calibrating like stuff from the external environment. So like sound, smells. It's constantly doing that, and it's basically like not broken, but it's like not functioning right. It's like
malfunctioning while processing.
Yes, it's literally like malfunctioning and sending the wrong signals. And then nausea is a big part of that too. So one of the things we did was basically, I wanted to just start to because people just end up doing, which wasn't your fault, but you just do over the counters and hope things get better. Yeah. But at some point, if it continues, we need to like address it and try to dampen it down.
Right. Because like you said, like you don't want it to be like to become a chronic thing that your brain is like, this is who we are now.
Yeah, it was doing that.
Right.
It was doing that, and it needs help to get out of that in a lot of ways.
And I was just talking to somebody, because I was like literally referring you, and I was saying like Botox has changed my life, which I never thought that sentence would come out of my mouth. Because she was been in a car accident for 5 years. Like 5 years ago, I mean, and for 5 years she's been struggling with debilitating migraines and like dizziness, and I was like, you need to get Botox right now. Yeah.
So getting like a ton of migraines and a ton of the symptoms.
Yeah. Like had to quit her job and get a part-time job because it's so bad.
Yeah. So you need treatment. I mean, you basically need treatment, and hopefully the treatment, like, so far pretty good for you, right? Like, we don't even need to, sometimes we have to do more treatments, but a lot of times it will settle things down.
Yeah.
And the sooner we do it, in my opinion, the better.
Yeah.
So.
And I want to just like briefly touch on like where the Botox is, because when I've been telling everybody that I got Botox, everyone keeps being like, where? I'm like trying to see on my face. So it's like, unfortunately, I'm not like, but it was like in my head and like my neck.
Yeah.
Like, and I want to say the first like 3 to 5 days after, I had a 5-day migraine.
Yeah.
Like it was so bad. I was in bed for like 3 days, and I'm like, Risa, what did you do to me? And then I woke up on day 5 and it was just gone. And I haven't really had one since.
Amazing.
And it's kind of interesting though, because I feel like sometimes, like I was saying, I have like specific triggers, like being on my computer for very long, and then driving immediately after. That's like my biggest. And I keep waiting for them to come, because I'm like, this is your time to shine, ma'am. Like, you know, and like I can sense that it's there, but it doesn't hurt.
Come out.
It's so interesting.
I know. So basically, you know, Botox was, this is really interesting, but Botox was first discovered and used in medicine by ophthalmologists. And what they would do, the eye doctors, is they would use it for people that have strabismus, where their eyes like a lazy eye.
Okay.
So one muscle is pulling the eye like too close to the other, and they're not tracking in sync. And what they would do is inject these tiny eye muscles to weaken them into the eye muscle, not into the eyeball. I know, it's crazy.
That's crazy.
And it would weaken it enough so the eye could like go back in sync with the other eye. It was really effective and really well tolerated. And then the ophthalmologists that discovered this, like, used it a lot, sold it to Allergan. That was the other company they sold it to. And they started using it for wrinkles. So they were like, oh, this is amazing. Obviously, that was a huge, great sale. Yeah. They got this great product, and they started using it like crazy. Then we found out that people, like, most common people that get migraines are like women in, 20s to 60s, right? Let's say, that's the most common people that get migraine. Who's the most common people that get Botox? Probably women like 30s to 60s, right? And above. They were finding that it was helping their migraines. They were just getting in their forehead, and they were finding it was helping their migraines. So then they started to do studies specifically for migraine. And what Botox actually does is it basically blocks a nerve from talking to this nerve that it has to talk to. So when a pain signal is being transmitted, it has to go along neurons. And basically that signal is blocked. It's like paralyzed. It paralyzes muscles because the muscles don't get the signal from the neuron. Yeah. And basically what we think is happening deep in the brain is that it's really stopping a lot of these signals. So you can almost feel like the process, and I've gotten Botox for my migraines too. It's the same thing. You feel like it's happening, but you don't have the pain. Yeah. And over time, it's like the best thing is that it's sort of resetting your brain so you don't get the headache again. Probably 10 to 20% of people get a really bad migraine after I do it, like that. And I think it's just because your head is really sensitive, and you're putting needles in this very sensitive place over and over again. There's a bunch of shots. But it really is not just like relaxing muscles, it's like stopping pain transmission. It's like
lidocaine in your muscle,
but longer. Lidocaine is very short acting, like it's like 12 hours maybe. Got you. This is like once it basically breaks this protein that so the signal can't get through, and the body has to build a whole new like protein arm. So it takes like 3 months to do that. 3 months. But some people it lasts longer. So when do we do that?
I think maybe July.
July? Okay,
Yeah.
we could take a look. But basically, it's for some people it lasts long. It lasts like months and months instead of just 3 months.
Yeah.
Some people they need it quicker, but a lot of people it really works pretty well.
So basically, in essence, Botox is the penicillin of migraines.
I mean, that's like, it's a good metaphor for sure. I think it's like one of the very good treatments we have for migraine. I like it because like you don't have to take a medicine every day, which is kind of nice. And, it's been injected so many times in this world that I feel it feels safe to me.
Right. Especially because like in the UK, literally they just like do it to themselves.
Really?
Yeah.
What do you mean?
You don't have to be a nurse. You can literally just be like an esthetician.
Oh,
that's why they're also
I
overfilled.
See. Really? The things I learn on this podcast. Really?
Watch Live Island UK.
Live Island UK? Wait, is that the truth? And that's not like a real show though, is it?
No, it's a real show. And then we were all wondering like, why do they look so old? And it's because they're like 20, but they look 40 because they're so like overfilled.
And they did it themselves? Or
They
had
do it to each other.
Wait, they can buy it and just do it?
You can literally buy it and just like inject, like putting in fake lashes and nails. You can like go and like.
That's crazy.
I know.
Is that real?
No, that's actually real.
Is that real?
You can fact check it after, but I Googled it after I saw it on TikTok.
So we have to check. We have to validate.
But I Googled it after, but Google's not always right.
Yeah. Wow. Yeah. Okay. So I mean, listen, obviously it has all the cosmetic benefits, but it's such an interesting like medicine in general. So I use it for migraine, I use it for something called dystonia, which is like when the muscles tighten up so much that like you see people where their neck is like their head is like crooked because their neck like the muscle is so tight.
Yeah.
So we use it for that. We use it for spasticity and people that have like cerebral palsy and one side is very the muscles are super tight. It loosens it up for a long time.
Yeah.
We use it for strabismus in ophthalmology. We use it actually for bladder spasm in urology. I know. We use it for and it's really good for pain. We've used it off-label in pain for like scars, neuropathy. I've used it. It's a very interesting chemical.
I was actually gonna ask you if we can add some in my neck because I'm always like.
Yeah, we can do that. We can definitely do that. Yeah. So after that, the dizziness, the other things went away.
Yeah.
So the processing of the headache, what I think happens is that everything downstream gets dampened down. So the dizziness, the nausea, the light sensitivity, even your mood probably. I mean, it's
because it was so irritable to be uncomfortable all the time.
Yeah.
Yeah. I still like I said, like I'm aware that I'm dizzy, but I'm not. So I just kind of get tired instead.
I see.
But which is such a better alternative.
But is that improving, like, also slowly or no?
Yeah.
You're still
Yeah.
Because you've been a lot more active, I think, right?
Oh my God, so much more active. Also, like, I've been doing yoga for like 6 years. Not being able to do yoga because like all the inversions were making me so dizzy has been like so nice to be able to like get back into like running, like all the things that I love
it.
You know,
I love it.
Yeah.
Okay. Do you have questions about like any of the other so I also gave you some other as needed medicines, which is great. That's
like
doable.
Nurtec. I've been taking that. I think I've taken it twice or 3 times in like 3-4 months, which is
that's not bad.
Yeah.
Okay.
And I usually take it like one night, like I said, I've had a really long day. I know I'm about to drive in the city and be out till 2 a.m. and I'm like, let me preventatively
take some Nurtec.
Yeah.
Okay. Yeah, people that do that. That's fine.
Yeah.
That's fine. Do you have questions about like what we did or what happened or?
No, it was honestly super smooth. Like I came in, I was here for 15 minutes. Like it was so quick. It was so great, honestly.
Good.
And I 100% did not believe it would work. I'm not gonna even lie.
Really?
Yeah. Then I had not like
really.
You know, like sometimes meds
man.
are like it's the placebo effect.
Yeah.
And like Tylenol apparently is like 30% placebo, but whatever. Like I was like,
yeah.
I was like, okay, she's shooting like Botox in my head.
That's really funny.
I was
you didn't tell me you didn't believe it.
At that point,
I was just mostly worried you were going to get a really bad headache for a couple of days because you were miserable, and then No, you got to go in optimistic. Really?
Well, I was so willing to just try anything
It's
at
hilarious.
that point.
Okay.
But and we sat here for a few minutes, and you were like trying to convince me to take it, and finally I'm like, I mean, I guess.
Yeah. No, I think the other thing that's really interesting is that you forget what it's like to feel normal. Like I've had that where I forget what it's like to be normal. You get used to like the pain and the heaviness and the dizziness or the not quite feeling right, and then when you feel good, you're like, oh, that's where I used to be. Like you're more lucid and you're happier and you're not planning your days around pain. And so I think it's a big thing. So you're not the only one that it takes convincing. It's definitely there are people that waltz in here and that's what they want, you know, and that's definitely what they want, but there are equal number of people that like do not want anything and do not want Botox and they're scared and so forth. So
well, I think which is why I honestly came on here, because I've literally been yelling this from the rooftops since I've got it. Because like I said, like there's so many people that it just becomes your normal. Like I was saying, that girl who was been 5 years and like that's just her normal now. Treatment. And I was like that's not normal. Like there's actually, I mean, it was so, it didn't hurt when you did it at all. Like it hurt a few days later, but like when you did it was nothing.
It's
nothing compared to the migraine.
It's nothing compared to the migraine. It's a very thin needle. I do it very quickly.
So good.
But I also like, in general, I think people are scared to get treatment. Like you were trying, but like you weren't getting treatment at all. Like there's other medicines we could have done and there's other things we could have tried even before that, and you weren't getting any of it because you were trying to like do the right things, you know, like using over the counter, using things that band-aided, physical therapy, all that. So
I will say though that people, especially when you're in a no-fault car accident case, you're not seeing the best doctors. You're not, people are not helping you the way they usually do. Honestly, the person that helped me the most was my lawyer, and he was like, you need to go see a neurologist, because everyone else is just like kind of trying to take your money, charge you the most they can. Not that doctors aren't well-meaning, of course, but I think they just don't know. You're seeing a trauma doctor, they're like, okay, you know, you look fine.
So I can explain a little bit like about that, which is scary and hard. But basically, the no-fault system in this country it's not perfect. I mean, it's something that they tried to do to make it so. I'm not even sure why it started, to be honest with you, because I'm not even sure, actually. I think people buy other insurance, like their car insurance, and part of that covers it. So then, let's say you get into an accident, then there's a fight. Like, who should pay for this? Should it be your personal insurance that you pay for every month in case of this, right? Like, I mean, and you can argue, well, I pay for my insurance every month, or my job does, or whatever. I expect that, you know, if something happens like this, that's where the insurance is supposed to kick in, right? So now it's like, oh, you get into a car accident, this other insurance is supposed to cover it, right? So that's the first problem. So then there's a fight about, you know, what should be covered, okay? And who's paying? And, you know, I've also had this happen too. I've done no fault work, and I think it's, listen, people that are suffering, I think they need help. And actually, as an insurance, they generally pay. They're a little bit harder to sometimes get some things done or get some medications approved, but I think that's like par for the course. And so what happens is doctors end up setting up like an office that's just no fault. Okay, and they don't do other insurance, or they'll do a mix, but they'll only do certain days. And then there's protocols that no fault expects you to follow. Okay, there's an algorithm they want. So like you come in, you know, typically with an accident, you maybe can get some x-rays, you have to do physical therapy, you have to start like this standard conservative treatment, which is anti-inflammatories and some muscle relaxants. And then you see it, and they do numbers, they do stats on what happens to people, and like 50% of the people get better in 10 weeks or whatever it is. The other people continue to get worse, so they try to parse out how they're going to pay, which is what the insurance companies do as well, to an extent. So many doctors I know, they just basically stop taking no fault because it's a lot of like there's delayed payment often, not necessarily more so than insurance companies, but it can be delayed, and you know, they sort of dictate what you can do and how you can treat. So the doctors are trying, but they're trying to get stuff that like will get paid for, so you don't get another huge bill and whatnot. And then there's the lawyers are involved, so there's always,
if you have like a lawsuit.
Well, a lawsuit, but also there's debates and arguments and litigation around the actual medical treatment. So you have to like get approval, you have to do this.
Yeah.
Sometimes they'll fight it. Sometimes they'll say, oh, you didn't mention that you had a concussion, like, right when it happened. But obviously you didn't know that that's what you were, like,
dealing
you had
with.
all the, that's not what you were dealing with. You're dealing with the acute, like, busted
swollen
nose and
face.
swollen face and horrible pain in your shoulders, and then the other symptoms set in, and then it gets diagnosed later. So it's definitely not a perfect system. It's a system that, I think is reasonable, but I do think a lot of doctors have stopped doing some of the work because it's very paperwork intensive and they dictate a lot about, they dictate what we can do and what we can't do in a lot of cases, and it's really frustrating. My experience is that that's continued. I still do a little bit of the work. I still think people, that's what happens. They hit their head. They deserve to be seen. Yeah, it's like a car accident or something falls on their head when they're walking by a, whatever.
You had that?
Yeah, it's
That's
like
so
crazy
funny.
stuff. I know, it's crazy stuff, and it's like whose fault is it? Like I had somebody I remember where they were sitting in a restaurant and like the shelf was like the shelf next to them was like high up, and like a wine bottle fell like on their head or something. I know. And it's like, whose fault is that, right? Whose fault is it? It's technically the restaurant's, I guess.
And
like
insurance.
Yeah. But it's covered under like no fault. So, they get stuck with a lot of this stuff that's like
Nitty-gritty
a little
details.
it's a little arbitrary and kind of like I don't know what they do in other countries. I think just the insurance would cover it.
Well,
like
most other countries have like Medicare.
Yeah, they have like more of a system, but it's
I'm
sort
from
of
Canada. We have Medicare. Like you just don't deal with it. Like you're born with Medicare, and then you just see doctors.
Is it Medicare? Or it's just like a bigger system. I think
it's Medicare.
Oh, really?
Yeah, you have this red card with your photo on it.
It's called Medicare.
It's called Medicare. Yeah.
Huh.
When you count to Quebec,
and
then you just
there
is like private pay doctors.
Yeah.
But like you just generally just don't deal with it.
Got it.
But I think like with the whole no fault thing, I found that like I was in charge of my own bill, so I made sure to like every invoice I got from a doctor, I sent it. I had like a rep. I was like, Melanie, please pay. I'd follow up. Has this been paid? Because like I knew the doctors were only going to treat me as well as they were being paid.
Yeah. That's great, actually. I mean, so that then the money sometimes gets, which again, it shouldn't be part of this treatment, but like it gets caught up, and then you get paid late. So that's good. It's good that you did that.
Yeah.
But it's hard when after you're not functioning so well,
Right. The first few months was hard for sure, and also like you were saying, because I was hit from this woman, like the first. So you have like a deductible, right? So when you select car insurance, like like you're filling out that questionnaire as when you sign up originally, and you're just kind of like clicking through and selecting the cheapest option, or that's what I'm doing anyway. So apparently one of those options are like what your deductible will be, how much they'll cover in case of a car collision. And
really?
Yeah. And so hers was 15,000. That's all they covered. So she basically covered my ambulance to the hospital. That's
and
it.
Then
and then the rest went to mine. Then it goes to your insurance.
Wow.
And then if you max out that at that point, because mine was only 25,000, at that point now you sue and you get a settlement from the person. So then you get like a lien against your settlement to pay. I see.
Wow.
But our point is, it's like, really complicated.
It is very complicated. Like besides all the sort of, all of the stuff that's like dark and not, it is a pain. Yeah. Like it's a pain and you need treatment. Yeah. And that's
it's
sort
a pain
of
and you're in pain and you don't want to deal with it.
Yes. And like, so well, I'm glad you're feeling better. That's amazing.
Yeah, no, and thank you again.
Yeah, like anytime.
You're a miracle worker.
No, definitely not. Just running the protocol,
Yeah.
I mean, I think that's a good question. I think in general, I want people to know that there is treatment out there, potentially, especially when things go longer than, quote, it should. So like the textbook definition of a concussion is that it will get better in 6 to 8 weeks. I don't know that always happens. And if you're really suffering, there are things to treat, like the pain, and things to potentially treat some of the signaling that's happening. So the dizziness, the light sensitivity. We have medications and Botox, honestly, both that we can use to try to settle that down.
Yeah.
For the majority of people, they get like a mildish concussion without a lot of history, they usually get better. But some of these symptoms linger, so I do think it's reasonable to check it out and just get potential treatment so you're just not suffering for forever.
Years, yeah.
Or years, or 6 months. I mean, 6 months is a long time.
It is a long time.
It's a long time. It's a long time
like
to
2
feel that
years.
way. Yeah.
Yeah.
It's a long time to not be able to, like, do something, you know. And again, it's not the obvious thing. Like, someone breaks their arm, they put a cast on for 6 weeks. It's miserable. They're impaired. They can't do what they're supposed to do, and then they take it off and recover. There's nothing to cast in your head. It's like, you know, and you have to do everything.
Right.
Everything that you think of gets impaired typically. Sleep, mood, visual perception, processing, you know, everything. And the more you're doing things for a longer amount of time, for the normal amount of time, like a day is, like working for 6 hours or 8 hours, and, you know, being on the computer and then answering emails and then doing stuff at home, taking care of the cat.
Right.
Cats. Yeah, I know. Two people that love cats. So
shout out to my cat babies.
Yeah. There you go.
Shout out to Lulu.
Yeah.
Multiple shout outs to cats. So
Lulu.
you have to take care of the cats, right? Like,
Yeah.
so, like, stuff like that. It's really hard. It's
Yeah.
So yeah, that's what I would like people to know.
Yeah. Oh, I have a question. Okay.
Yeah.
So I feel like we did talk about this, but it still confuses me just a bit. So will I need to get Botox for the rest of my life, or is
Very
the
good
goal
question.
that through numbing the pain, I'll giving myself time to heal without healing in pain, and I'm stopping this repeated pattern of my brain creating the migraines?
That second. That's the second part is what I want. That's the optimal outcome.
Yeah.
Listen,
So it's not a Band-Aid.
It's not a Band-Aid. It's a Band-Aid a little bit because it's supposed to cover that pain. But from my perspective, and in the migraine world and in the concussion world, like, we want to reset that threshold that went too high. We want to bring it back down to where it was before. And the only real way to do that is, one, it can happen naturally, but you have to kind of force it to not be doing the pattern again.
Yeah.
The brain loves to do what it knows how to do.
Yeah.
So, you know, think about how you even do something that you're good at, like play a game. Like, right? The more you play it, the better you're going to be, the faster you're going to be. The more you play the piano, the more you're going to get better at it.
Like muscle memory.
It's exactly the same thing.
Okay.
Okay? It's like not exact. The neural pathways are not as well understood, but it's the same type of thing. It's quote muscle memory.
Yeah.
It's literally pain memory. There's like a whole signature that it just gets stronger and stronger, and that's exactly what happens. So, like, people don't, you know, that play the piano or play the violin, they don't even think about it anymore.
Right.
It's like totally part of themselves. Pain, unfortunately, for people that have chronic pain, years and years of that, that's what's happening. It's just a signal that's like, yeah, it's sad. It's crazy.
Yeah. My mom is on NLP specialist coach, which basically is the
What's that?
neuro-linguistic pathways.
Oh.
And basically what she does is super similar, but for the emotions, where like if you continuously have an emotion, okay, for example, trigger warning, if one time,
What's the trigger warning?
well, if you've one time thought about suicide, every
God.
time going forward, you have the minor inconvenience in your life, your brain is like, should we die? And
God.
It's just that your brain is like, this is an option now. And
No,
you need
it's an option that gets stronger.
exactly.
Yeah.
And the more you don't shut it down, the louder it gets.
Yeah. And the stronger it gets.
the
Actually, the
stronger
stronger
it
it
gets,
gets.
yeah.
So that's the same with anxiety. That's probably the same
Right.
with depression. It's definitely with
Exactly.
anxiety.
Yes.
So that's an easy
The
thing
more
to
you
sort of follow.
OCD as well,
Oh, yeah.
you know?
OCD as
yeah.
well.
So
Yep.
what my mom does, right, is that she'll train people on how to, like you said, reset their brain and stop the patterns in their path.
Wow.
And recreate new patterns.
Like a new path.
Yeah.
So she works with people that have pain, anxiety, OCD.
So emotional, yeah. Yeah.
Ah.
And then also including language disabilities.
Oh, that's cool.
Yeah.
I love that.
Yeah.
She's busy, I'm sure.
She is busy. Yeah, she just like opened her new like practice. She was actually just talking to this guy that I work with, he also has like this is super tangent-y, but he has this company where he helps like specifically like single moms or like families in need of help or like mental illness type of thing. So she's gonna start working with him now, which is cute because I work with him also. So now we're all working together.
That's cool.
But I work with him in real estate. But
so she like licensed?
yeah, she's licensed. She has a master's in like neurolinguistics, and then she has an NLP coaching degree, but she wants to go back and get a master's in social work so that she can like properly help, because right now if it gets within with outside of her scope, she'll just refer them out. You know Meryl? Yeah, so I connected her with Meryl, so she like consults with Meryl as well sometimes for like
That's cool.
younger children that have
They like might need medication, or it's like a little bit more serious.
Right, when it's a little bit more serious and they're acting out in a way that's bizarre.
Yeah, but that's a great option. You got to get that information. In general, people are always looking for that. That's like a great add-on, and yeah, that's awesome.
Yeah. And her whole thing also is, you know, I think a lot of people that go to doctors and medicine, like when I talk to people, their fear is that like they're going to become dependent on whatever the doctor recommends, and they're like, I don't want to do this for the rest of my life, right? Like with Botox or whatever.
Yeah.
And her whole thing, and your thing as well, right, with the Botox is like, this isn't for forever. The point is to cut it off at its head.
Yeah.
Pun intended.
Yeah, exactly.
And so her whole thing is like, this is temporary. I'm going to teach you the skills to do this yourself.
That's awesome.
Yeah.
I love that.
Shout out, Mom.
Yeah. Maybe we have to get her on here.
You would love her.
Yeah?
Yeah.
Okay.
She kind of looks like you.
Really?
Yeah. I'll show you a photo.
Okay. I think we can do that.
Yeah.
Cool.
Yeah, and she trains me for ADHD. She helps me.
Does it work?
It really does. I was like having some issues at work where
I just don't think you have ADHD.
So it seems funny because I'm super still, right? And I can hyperfixate. So I can like sit in front of my computer from 9 a.m. to 3 p.m. and not move. But
that's not ADHD. I just feel like you are actually really good at focusing, and your thoughts don't get scattered, actually. Like
so I don't get scattered. So she thinks, my mom agrees, I think it's ADHD. She thinks that it's executive functions, and that it's just patterns that were created where I kind of go on autopilot.
Like distractions, yeah.
So she's given me some really, really great like tips on like how to slow down. Like I know I need to slow down. Like that's my issue, is that I do things too quickly and then I miss things.
Mm-hmm.
So I'm like, I know I need to slow down, but how? And so she's given me like really good steps, which sometimes seem obvious, but which are really working. I've seen like a really high increase in my quality of work the last couple of weeks since I've started with
Good.
it.
I like it.
Yeah.
I totally appreciate you coming on here and sharing your story, which, you know, I'm so glad you're okay. It's totally insane.
Yeah.
And yeah, do you want to let people know where to find you? Do you want to plug yourself? You can.
No.
No? Not at all?
No, I'm okay, but I think if you have a migraine, reach out to Risa. It will change your life.
Oh man,
no, like,
that's a big plug for me.
When I tell you I have been shouting your name off rooftops, I literally was at the bar last week and like showed somebody your Instagram. I'm like, you need to go.
Wow. Well, that's cool.
Yeah.
Thank you. You don't have to do that though.
I'm not doing it for you. It's for her.
Okay.
Like people should know.
Yeah.
You know?
All right. Well, thanks for coming all the way to the city. And yeah.
Yeah.
Keep helping you.